Theories are important in clinical practice for several reasons. It can guide decision making. Nursing theories provide a framework that can guide decision making in clinical practice. They help nurses to organize their thinking and make informed decisions about patient care. They can enhance critical thinking skills. The use of theories in clinical practice can help nurses to develop their critical thinking skills by analyzing patient situations through the lens of a theoretical framework. Nurses can develop a deeper understanding of a patient's needs and identify more effective interventions to meet these needs. They can improve patient outcomes. Nursing theories are based on research and evidence, so they've been shown to improve patient outcomes when applied in practice. By using theories to guide practice, nurses can provide more effective and efficient care to patients. They can promote patient-centered care. Nursing theories emphasize the importance of patient-centered care, which is essential in today's healthcare environment. By understanding patients' unique needs and values, preferences, nurses can provide care that's tailored to the individual patient rather than a one-size-fits-all approach. Nursing theories can support professional development. The use of nursing theories in clinical practice to guide the practice, nurses can expand their knowledge and skills, become more effective and confident practitioners. And yes, theories can make a significant difference in the quality of care provided to patients. They provide a framework for organizing and understanding patient data, identifying patients' needs, and planning and implementing interventions to meet those needs. So by using theories in clinical practice, nurses can provide more effective and efficient care that's tailored to the individual patient. It can improve patient outcome, reduce healthcare costs, and enhance patient satisfaction. For example, a nurse using a theory that emphasizes the importance of patient education can be more likely to provide clear and concise instructions to patients about their medications and treatment plans. This can improve medication adherence and reduce risk of adverse events. Similarly, a nursing theory that emphasizes the importance of therapeutic communication, the nurse may be better equipped to establish a trusting relationship and better build a rapport with the patient that will promote healing and improve patient satisfaction. One way to determine if a nurse is using a theory to support working with a patient is to look for evidence of theoretical concepts and principles being applied in the nurse's actions and decisions related to patient care. An example of this would be using a holistic theory like Betty Newman's model. They may take into account the patient's physical, emotional, social, and spiritual needs, like in Betty Newman's theory, where the model views the client as an open system that responds to stressors in the environment, where the client variables are physiological, psychological, sociocultural, developmental, and spiritual. They may also emphasize the importance of building a therapeutic relationship with the patient and incorporating the values and beliefs into their care plan. Another way to determine if a theory is being used is to ask directly. Nurses who use theories in their practice typically knowledgeable and about the theoretical framework they're using, and they can explain how it guides their approach to patient care. One can also review documentation or notes taken by the nurse to see if they mention any theoretical concepts or principles. Might include references or models, as well as descriptions of how they're being applied in practice. If a nurse is not using a theory, several signs can be noticeable or taken into account, like a lack of a systematic approach. The nurse may not be assessing patients, identifying problems, or developing a care plan. Inconsistent care. The nurse may provide inconsistent care, failing to follow established protocols or standards of practice. There could be ineffective interventions in which the nurse does not use evidence-based interventions that meet the patient's unique needs. Limited assessment in that the nurses fail to explore every aspect of the patient's physical, psychological, and social needs. Also, poor communication. The nurse may struggle to communicate effectively with the patient, the family members, or other healthcare professionals, which can lead to misunderstandings and potential errors in care. Also, a lack of patient-centered care. not prioritizing patients' unique needs, preferences, values, leads to a less than optimal patient care experience. Yeah, and then theory use in the clinical setting can have a significant impact on nursing quality, safety indicators, and patient outcomes. Some ways that it can do that is by improving the understanding of patient needs, better communication, increased safety. Nurse using a theory that emphasizes the importance of education, like I said before, can provide clear, concise instructions to the patients about medications or treatment plans, can reduce risks of adverse events, and just overall improve patient outcomes. The use of nursing theory can help nurses provide more holistic care that takes into account all aspects of healing, reducing pain, and overall enhancing well-being.